campaign being launched this morning is encouraging gay and bisexual men in Ireland to get tested or retested for HIV. The campaign aims to stress the advantage of knowing your HIV status. The Know the Score, Get Tested campaign comes in the wake of a recent survey which revealed that 83% of gay and bisexual men surveyed considered their risk of contracting HIV as unlikely or very unlikely, despite 70% admitting to having had unprotected sex. I'm joined in studio by entertainer and gay rights activist Rory O'Neill, aka Panti, and by the Associate Specialist in Genito-Urinary Medicine at St James Hospital, Dr Shay Keating. Good morning to you both.
Hey, Pat.
Let's talk to you, Dr Keating, first of all. The survey, it's not a huge survey, but it's a significant survey.
It's not huge. It surveyed about 500 plus people. And it's very, very significant because if you can appreciate that 83% is a very big number of gay and bisexual men who don't think their behaviour is risky, that's really, really upsetting. Because if you don't know your behaviour is risky, you could potentially be infecting yourself. So
70% of sexually active gay and bisexual men have had unprotected sex. That's 7 in 10. And almost 1 in 10, 9%, say they always have unprotected sex.
Yeah. Well, obviously it's a choice you make, but it's you really want to know the consequences of that choice. And I think if you have unprotected sex on a regular basis, you will become HIV positive at some stage. It's almost a given.
Now, what are the numbers like in Ireland? I mean, is it a problem that is growing, or is it a problem that's in more or less equilibrium?
Well, year on year it grows all the time. I'd say to date we've tested about 5,000 people who are HIV positive. But I think it's quite worrying if you look at the demographic. If you go back to, we say, 12 years ago to, we say, 2002, there were 300 people diagnosed with HIV, okay, and move that forward to 2013 and 344. So there's no drop, in spite of all the information we've had, all the campaigns about safer sex, safer injecting. There's been no drop in the number of men of sex and men who are being diagnosed with HIV. On the contrary, since 2005, there's an increase in 180% in the cohort of men who have sex with men who are diagnosed with HIV.
It used to be seen as a death sentence, a diagnosis of being HIV positive. I mean, years ago, you can go back through all the STD scares.
Yeah.
And I mean, herpes was one, and people thought that was the end of the world.
Yeah.
And then suddenly HIV becomes real, and people think, well, herpes, what's herpes? You know, you can live with that, no problem. Have we come to that point now with HIV? The people are saying, yeah, sure, you can live with that. It doesn't matter. There are these antiretroviral drugs that are out there. You can, carry on.
Yeah, well, it's actually quite interesting that we're here talking today because HIV was diagnosed as the cause of AIDS 30 years ago, and in 1984. And as you mentioned there's been a huge increase in the amount of knowledge, the amount of research that's been done into HIV. And as you mentioned, when you put somebody on the antiretrovirals or the anti-HIV medication, there is almost, if the person is adherent to the medication and takes them at the appropriate time and at the appropriate dose, you can almost guarantee that they'll be what we call virally suppressed, or the amount of virus in their blood will be undetectable. And that has huge implications, I should say. Number one, if you're on medication and you're virally suppressed, you're obviously going to live a perfectly healthy, normal life. Your immune system is going to be completely competent. And that's number one. But number two, and probably just as important, if you haven't got a detectable amount of virus in your blood, the chance of you passing it on to somebody else through sex is almost minuscule.
So the message is, and we know that men particularly are reluctant to go to doctors about anything.
Mm-hmm.
I mean, never mind getting tested for this. That if you do test, knowledge is power.
Knowledge is power, absolutely. And I think one of the problems we've had to date in this country is people didn't know where to go to be tested. But now Janssen have got this new app isn't the word, but a new online locator map where if somebody wants to find out where to go to get a HIV test, they can go on two websites. One is the mantoman.ie website and the other is dublinaidsalliance.ie. And on that we have a list of across Ireland of 32 locations where people can go to access a free HIV
test. So it costs you nothing.
Costs you nothing, free HIV and free STI.
How often?
Testing.
I mean, depending on their behaviour, I suppose.
Absolutely.
If you don't indulge in any kind of risky behaviour, once you get tested, and a retest would be a very occasional thing.
Absolutely.
If people are indulging in risky behaviour, how often should they be tested?
Certainly, I would recommend somebody who's involved in risky behaviour at least twice a year, minimum twice a year, because you're only as good as your last HIV test, and you need to know your HIV status.
Yeah. Now, Rory, you are HIV positive. Can you bring us back to your diagnosis, how long ago it was, and what the atmosphere was like about HIV at that time?
I was diagnosed in 1995, and at the time it was a death sentence.
Yeah, it's almost 20 years ago.
Yeah, I mean, I was saying to Shay earlier that I clearly remember being given my diagnosis by my GP, and what I remember most clearly is feeling really sorry for him. Because he felt, clearly it was a very awkward moment for him. He was giving a guy in his 20s a death sentence, essentially.
And how did you react to that? I mean, did you feel that the clock was ticking and time was running out? And how did you react?
I was very aware of what he was telling me. It came as a huge shock. I was not expecting it. I did not go thinking, Was
this a routine test?
It was a routine thing, and as far as it just came totally out of the blue. But because of the time that it was, I had known people who'd been sick. I had known people who died. So I was under no illusions as to what he was telling me. And my doctor's office is just off Grafton Street, and it was this perfect, gorgeous, sunny summer's afternoon. I can remember walking out of that office and crossing Grafton Street, and all those women are selling daffodils, and I'm thinking, how can you be selling daffodils when I'm dying?
Well, of course, Daffodil Day is.
But I just got on with it. I'm a sort of practical person in a weird way, so I just sort of got on with it, and I was very lucky, really, in retrospect, because although yes, at that time when I first went to the clinic, it was sort of a horrible atmosphere. There were people dying, there were people who were sick, and you were sort of put on this conveyor belt. And the assumption was that this conveyor belt would slowly take you to a funeral. And I remember on my very first clinic visit, you were sent in to see the social worker who spent 10 minutes explaining to you, you can get an allowance for a blanket and you can get a fuel allowance, because the assumption was you won't be working anymore and you're going to be sick. But I was very lucky, because within a year or two, all these new treatments started to come on stream.
And had you begun to suffer from any of the symptoms that would mark the onset of AIDS?
No.
Which is,
No, I was very lucky. And when I was diagnosed at the time, they were really into hitting early, hitting hard. So they just dumped a load of drugs into you. Yeah. And but as I said, I was very lucky, because very quickly after I was diagnosed, these new antiretroviral treatments started to come on stream, and they have been improved and improved and improved. So I have always been feeling in a situation where things have just constantly been getting better. So I in retrospect, I was very lucky the time that I was diagnosed.
I mean, AIDS stands for Acquired Immunodeficiency Syndrome. Mm-hmm. So you have the virus, but you don't have the syndrome at this particular point.
Yes, I've never spent a day's illness in my life. And nowadays, if you are tested and you know your status early, there's absolutely no reason for you to ever be sick, because the treatments nowadays, it's essentially a chronic manageable condition, but you need to know you have it in order to treat it.
Because you live with HIV rather than die from it.
Yes, so exactly. I think when I was diagnosed, it was a death sentence, but nowadays it's more. I mean, Shay might roll his eyes at me here a little bit, but it's a bit more like having diabetes or something. It's something you just need to manage.
Can you contrast the early treatments that you had compared to the drug regime today?
Yes, in the beginning, AZT was the big one, and it's a really powerful and horrible drug, and it turns out in the long run was pretty useless. But then also in the very beginning, when the antiretroviral treatments came along, and they call it combination therapy, they give you a number of drugs that all hit the virus in different ways. And in the beginning, I was taking 38 tablets a day, all at different times and all of that.
38?
Yes. And you had to have, you felt like an old granny, because you had one of those pill boxes with all the times on it, and which ones had to be taken with food and which one didn't have to be taken with food, and there was a lot of side effects. But nowadays, a lot of people can take a particular drug that is literally one tablet a day.
So it's a combination.
Yes, in that one tablet. So a lot of people can take literally one tablet a day, and you get on with your life. Or some people can't for various reasons, reactions, whatever, and they might have to take slightly more, 3 tablets a day. So
this contrast, if we remember, I'm sure you saw the movie The Dallas Buyers Club,
yes.
and that captured very much how haunted people were by AIDS in that era.
Yeah.
now we have the opposite. I mean, you're saying to people, and I mean, I'm sure Shay is, as you say, throwing his eyes up to heaven. You know, 1 pill a day. You know, you might as well be taking anti-blood pressure.
It's a weird one,
pills.
isn't it? Because I don't want to downplay it. If you are, you know, like, you know, if you were diagnosed tomorrow, you know, with any chronic condition, it's a big deal, and it's something you have to deal with, and it's a pain in the hoop, if I can use that expression. So I'm not trying to. I don't want to downplay it, but at the same time, I need to be honest with people. It isn't a death sentence anymore. But at the same time, it's a pain. You
neglected,
don't want to.
like any condition.
That's the point.
It can lead to something that will turn out to be incurable.
Exactly. You need to know what your status is, and if you are HIV positive, you need to know that, and know that soon as possible. Because the sooner you can get it treated, you know, the longer and healthier your life will be, and you can become uninfectious if you treat it well enough and properly. And I say that the one thing that, you know, part of the reason that I've gotten involved here is because the problem here is the stigma. In the past, there was this huge stigma and the sort of blaming people, you know, for that they bloody deserve this or something. Yeah. And a lot of that lingers on, and there's a lot of ignorance still around it. But the point is that if people didn't feel a stigma about it and were felt open to be able to say, in the same way that you might say they have any other condition, that, you know, that I have HIV, then everyone would suddenly discover you all know people who are living with HIV.
Do you think it's all wrapped up in the prejudice against gay and bisexual people?
Oh, totally. There are these moral judgments around.
I mean, because it is a heterosexual condition as well, not to the same degree, but
it certainly is. But it's not even. I think a lot of it is to do with the homosexual side of it. But there's also just this sort of, you know, shaming around sexual behaviour. Because there's this weird idea that somehow you can blame somebody for having this condition, but you can't blame them for having cancer. You know, an innocent person gets cancer, but you can't be innocent and get HIV. There's this weird stuff about it. And of course, in this country, we spent decades shaming people for their sexual choices. You know, there was a time when a young woman becoming pregnant outside of marriage was worse than getting a fatal diagnosis. And yet, did that stop hundreds of thousands of young people, you know, becoming pregnant? No, it didn't, because our biological drives are pretty strong. And shaming people for their sexual choices in the past, you know, ended up in this country with, you know, water tanks full of dead babies. So, you know, that's not something that's worked for us in the past. So people need to not be ashamed. So you've got a condition, deal with it.
The good news is detected early and in good time, it can be treated to the point that life is absolutely normal.
Yes.
Absolutely normal.
I literally don't even think about the fact that I have HIV on a day-to-day basis. I go to the clinic 4 times a year, or twice a year actually at this stage, you know, for my checkup, just to make sure that everything's still flying along. I take my 1 tablet a day on autopilot. I don't even remember, you know, sometimes I think, did I take that yet? And I don't think about it until I end up having a conversation with you, Pat. Now,
you know? Another question which I'm sure will be occurring to people, because it's occurring to me, that and I don't know anything about your personal life, but in terms of relationships, and someone says, well, by the way, are you HIV?
Well,
now you're very public about it, so they don't have to ask that question. But you know what I mean? In a world where people are curious about such things.
Yes, I have to say that one of the things that I would just like to be able to change very quickly is that I have had that conversation. I'm a single guy. You know, occasionally I meet people who might want to date me, surprisingly, and I have to have that conversation with them. Everybody makes their own decisions. I have a 3-date rule. I discuss it with them on the 3rd date if they don't already know.
And if they're listeners to Newstalk, they now know.
Yeah, so well, you know, some people freak out and you never see them again. Some people are, you know, who have the information and they know the real situation, are fine with it. So it's a case-by-case basis.
Shay?
Yeah, could I just say, echo everything that Rory's just said there. Now, what I would say is, I'm sure Rory won't mind me saying this, that he's a known entity. He knows he's HIV positive, but he also knows he's virally suppressed. He's on the appropriate medication, and he's theoretically, if he's otherwise well and he doesn't have any other sexually transmitted infections, he's not infectious. So if somebody he meets somebody in his own bar who's doesn't know his status, he could very well be HIV positive, could have a very high viral load, and a stranger meeting that person would be way more at risk of getting HIV. So ironically, somebody who knows their status and is on the medication, get tested and get retested.
Final question, Shay, is about this virus itself, or this retrovirus. I mean, is it one of those mutable things that is finding ways to get round all the drug therapies that are being thrown at it? Is it likely to emerge someday as the threat it once was?
Well, that's the big problem we've always had with HIV medication. The virus has always been able to outsmart the drugs. Now, it's one thing outsmarting one drug like AZT. It's very easy to outsmart one drug. Even 2 drugs is getting kind of difficult. But when you've got 3 drugs, the whole notion of taking triple therapy is to stop the
virus doesn't know which way to turn.
It doesn't know which way to turn, and it does work very, very well only if the patient takes the medication at the appropriate time. So adherence to medication is really important.
All right, well, the messages are loud and clear. Get tested or get retested. Dr Shay Keating of St James Hospital and Rory O'Neill, a.k.a. Panti, thank you very much, both of you, for joining us.